I am happy to present to you a colleague, an orthophonist, and here we have the pediatric orthodoncy. So today we are going to start the scientific area, since the conference was a bit specific, concerning the Congress of Pediatric Orthodoncy. So what appears here on your screen, all over your screen, she's going to explain the daily practice of an orthophonist with the first word. So how can we include in this daily practice without transforming in any way, then just simply by adding an option, a supplementary option. Clémence, the word is yours. So we find you back in the question answers. Thank you very much. Hello to everybody. Hello to Guillaume. Thank you, Guillaume and Dr. Silis and FroggyMouth, to let me present my work on a daily basis. As Guillaume has already mentioned it here in this conference, it's really to present FroggyMouth to you. So there is not so much theory. This is really to present to you how I introduce FroggyMouth with my patients and how I evaluate their progress. So I'm going to start by present myself. My name is Clémence Barrière. I'm an orthophonist since 2016 in Lille, in the north of France, for the people who don't know me yet. And I have been working in the functional reunion for about 3 years, and I've been working with the FroggyMouth as a tool since January last year for 1.5 years now. And as a small anecdote, Guillaume contacted me because I'm an illustrator on Facebook, and on topic of a webinar to all the French orthophonists that allowed me to explain what Frog is all about. In this webinar, there was a free of charge example. I ordered one more, and so we were able to test on our own if there were any results for the patient. And as I was convinced, this is what I'm here today, and this is why I'm here every week, and my presence. So concerning FroggyMouth, how can I do it? Which time I need to present to my patient? When do I start the FroggyMouth with them? Me as a prerequisite, the nasal respiration, which is quite important. However, I really start the nasal breathing, and once it's automized, because sometimes it's quite long with this nasal breathing, I propose this product because when you breathe through the mouth, so if the tongue is there, so if we have the nasal respiration, it helps quite a lot. And it's good if we have the patient who starts, and some people have really bad nutrition issues. And around the mouth. And even if this is a child, then it's important. And at what age I offer the FroggyMouth? I usually use it with children. I start at the age of 3 because I start quite young, and 3 to 7 years. After 7 years, you sometimes see some patients have some difference, but beyond the year of 7 years, the patients have the maturity to be able to work on the denutrition in a way on purpose and not automatized. And that makes it a bit faster to have an adult denutrization. That allows me to have a bit of time. So I have started a small video for you, and the aim is a short video as if I presented it to my patient, if that's okay. So I'm going to give you the video to show you how I explain this to the families. But I will get back to it if that's okay. I think we cannot hear the sound on the video. So if you can share your screen. So, yeah, maybe you could share your screen. Right, hang on. So I will continue. Is that okay now? So, yes. So here, the problem that we have is that at the moment your patient is too young to be able to have the deglutition and doesn't have the maturity at his age yet. So the chance that we have is that we've got orthodontics that have this little gadget, which is called FroggyMouth, and this will help the deglutation, automized deglutation without your child needing to do anything. So I'm going to explain how this works. So here, what we do for denutrition is you have to keep this gadget during 15 minutes in front of the TV. I'm going to explain to you why you need to have it in front of the TV, because the FroggyMouth is a little plastic lip that you put around your lips, your upper lip and the lower lip, and you cannot close your mouth, and it allows the fact that there is pressure on the teeth and all the muscles are then contracted. When you put on your FroggyMouth, it is impossible to close all your muscles. So your brain will get used to this movement and will not be able to swallow as normal. So they're going to try and find a new solution to swallow, and this is how it works. Normally, we keep it during 2 or 3 months, 15 minutes a day, and then seeing as this moves forward, we can use it. We said we use it in front of the TV. Why do we use it in front of the TV? For 2 reasons. Because the TV is on the same level as the eyes, so you keep your head straight. Because if you make an activity and you move your head forward, then with the gravity, your tongue will also fall forward, and we want to avoid that. And to be able to avoid, we want to avoid all activity that can be made by the head. So the second reason is that the TV is something that children enjoy and like. So in the brain, it's something nice, and there is a positive idea because the brain is doing something it enjoys. So the new deglution will be correct, and it will be something motivating and something nice. So the motory gesture is then positive. I explained this to you today because I'm going to give you some leaflets and let you discuss this with your colleagues, with your family members, and next time, please tell me if you're happy to work with it. So this was the short explanation for the parents. I will try and show them, if Barrière allows it, on social media, and we're going to see this later. So having said this, with this explanation, I wanted to pass on because it's a lot faster. I'm going to explain to the child who's going to keep a froggy mouth, which is going to transform the child in a little frog mouth, and they have to keep this froggy mouth for about 15 minutes per day. We do the test together. So I wear my little frog mouth and we play, we make pictures, and we transform ourselves into little frogs. So it made me laugh, and I put you a little extract of the mouth of my little patients, and I think it's quite funny. For the more practical aspects in the rehabilitation, what does it look like? My patients now, I used to see them every week now, and then we have about 15 days where we meet, and I explain to them how the FroggyMouth works, and we take them back into every session. They've got to bring in their own FroggyMouth, and this is how we proceed. And then for every beginning of this, they put on their froggy mouse and they try and do this in real conditions. I don't have now in this practice the pictures. I don't have a TV, so I put YouTube on my tablet and I put it up on books so that it's on eyesight level, and then I do exactly like this at home. And yeah.
So the parents always try to analyze very quietly what are the remarks, what I see, what is the opinion of the parents, to see if they agree with what I share with them. And then we see how we work together, and is he finding its way, and see how you can work with this device in the session. This is really important, because the children take it out, put it back, take it out, take it back. And so I explain why you should keep it. And so they play all the time. They just play with their mouths and then take it out and put it back. And so it's really annoying, because it should be placed and it shouldn't move. It's the way it is. So further on, I explain to the parents exactly what we should do, and during the 5 minutes you will see that nothing is going to happen. And so it is when you have the froggy mouth, they keep their saliva in their mouths, and that's really difficult. There's no swallowing, so it's really important for them. And so I show to the parents how you can stimulate here, pressing here on the chin. And so I help them. So if you just push here under the chin, and then you will see the child that will swallow very quickly. And so and this is really important. And during the session, we try to see and see how we can work with the breathing, and we see how this is how I can push the floor of the oral cavity, and so it's the way that I can help them to swallow. So this is what I showed a while ago, and so it is really important to keep the device, and I think it's really important to keep it for let's say a little time, and because the parents have got questions, so it's really important. Why is my child behaving like this? And so I show the little tongue of the patient, and so they they do drool, and how they look for the swallowing, and so the drool is just falling, and it's important to see how they can keep a handkerchief or clean so that they can dry their mouth. And so they just are doing this sound that I'm showing, because I don't see any problem when they just and I said to their parents, and I try to test it with the parents, keep your mouth for open for 15 minutes, and it is very difficult to bring the saliva backwards, and so to swallow. And so if you don't have your lingual muscles and the muscle in the back of your tongue, you need to swallow. And so I try to watch out and see how they will just react. And so that's the way. I am really grateful. And so this is really important. We will discuss it with some people, but I think that's the best option. I didn't make any random studies for this conference. I just have a few patients, 7 or 8. It's a small sample. And this is how we can use the frog mouth. And so the froggy mouth is really helpful so that they could swallow and do their exercise very simply. So if the child is accepting the froggy mouth, is it working well? And we had also a new patient in pediatric care, and he had some problems, so it took some time to be adapted to the FroggyMouth device, and all the patients say, but one patient said that they forgot to that they have a froggy mouth, and so no, and the parents they cannot forget. So the children, they like to see the different cartoons, and so they hold their device, and during 15 minutes they have the froggy mouth and they see the cartoons, and so they have the froggy mouth, and they enjoy it because it's a way to look at the cartoons on TV, and if they have also made progress as far as the swallowing. We have, let's say, a result of 50-50, but it's an anonymous study, and some parents are assisting in the different sessions, and this is a reason why little brother and sisters may also interfere. But I like also to have them around because so that we can analyze the way the child behaves and the way there's a progression, and so I give some advice, and I'm very happy to be there. And so this is really important. I give a message and then I explain the why. And so my objective is to give an analysis and a remark of the session and the way the child is behaving. And so we have also the same behavior as far as some people that were not in the session are not asking questions, but when they are in the session, they ask a lot of questions. And so it's quite important, and it is the observation that we have. So this is some clinical situation. I don't have a lot of time, but I would like to finish and show you these clinical situation, and if we can try to work with the children as soon as you can, because there's not only the question of swallowing, but all the different functions, the way that you have to masticate, the position of the tongue, and so this is really important at this level. I want to put the stress on this, and this is really important. So this is on the left, the eldest photo, and the right one is the youngest. They were between 2021, and this one were taken on the right 3 weeks ago. So this is just to show you the difference. And so what can we observe? So I have to take let's say the mouth of my patients, but we are in Lille, and so they are not a suntan because it's the north of France, but you will see that their skin is much better, and you will see also the way they express themselves in the face is really important. They are looking very sad, and you don't see all the eyes and the whole face, but you can see, and look at this. So he was very sad on the left, and on the right one, the newest picture is really happy, and you can see it. So it has a much better face on this one, and like this one too. On the right, you see the difference from the last one. These small patient, this one in particular, after 7-8 years. So I try to teach them the way they should swallow, and when they have 7 years and when they reach the maturity to do it, this is how we can work. This is eat, and we eradicate these little patients, and we try to the possibility, and this is the froggy mouth that you will have every day for 15 minutes in front of the cartoon. And so he chose this option, and he was very happy. And thank you so much for your attention. Thank you for all the questions. Yes, thank you so much, Clémence. It was a very interesting conference, and thank you for this pool that you have been doing with the parents. We have 3 minutes for the questions and the answer, but I am going to recall that all these questions will be found on the side. But the first question I have for you: how how do you see the acquiring of these device, and how can they buy it on the site? This is a question I hear a lot. So I say, on many cases, I have an Instagram account, and I say, you have the option. You can order the FroggyMouth on the site, and then I have a little stock in my practice, and I see that you have the possibility to have a reduction, and you see that, of course, you don't have to pay the postal fees, you don't have to pay all the different options, and it's cheaper to buy it in my practice. Is it difficult to have an introduction? Do it by 5 minutes, 10 minutes, and 15 minutes. Yes, we can do it with all my patients that have some troubles for eating. They can keep it for a few minutes, and then we increase all the duration until 15 minutes. Do you eat with them and drink with them? No, I don't do it. It's not necessary, but I didn't explain when we are a little bit further in the practice. I explain to the parents how they should swallow, and I make a little test with a little food or a little drink, and how can you see the breathing with the nasal pharynx. This is I work mainly with the different specialists, and I know that this is really important to work. This was also the different specialists and the ENT specialists, and this is really important for me. And so we work. It's a question that we have been working. So at 3 or 4 years, they have to masticate, we have to swallow, and this is not done naturally at this age. So you have to teach them, and you have to provoke this swallowing. So because if it's not done naturally, so you will have a lot of problems. And so I am going to answer a small question that was asked by Stefano Di Vecchio, and he's asking us, is it possible to sleep with the FroggyMouth, and is it possible to sleep with the FroggyMouth? I think that we've worked 15 minutes a day. It's more than enough. If you have special cases, particular case, and if you need to have the device for a longer time, then it's up to you and the practitioner to discuss. But for these medical device, not more than 15 minutes for a child. And so this should be also adapted to each situation. Can we put the FroggyMouth during the night and the whole night? That's different. So we know that they can lose the FroggyMouth during the night, and so they will drool. And so last question, how are you going to practice this automatic new breathing? It will take more than 5 minutes to tell you, but you can answer on Facebook because the nasal breathing, it takes time. So I will answer on Facebook. It's going to be easier for me. And so you can stimulate to clean the nose. This is really important. And you should also use a serum, and then smell some different flavors, and then you have to work. But I will answer on Facebook. It's going to be, because it's going to take quite a while, and so I will answer on the group of the Congress, and all the participants are on Instagram, and you will give all the different tips for the daily practice. And thank you so much. We will have 2 answers, and thank you so much, Clémence Barrière, for your help and to participate in the Froggydays.